Well, good morning, everybody. Thank you to Dr. Donovitz, Mark Hincher, and the entire BioT family for the invitation. I really enjoy doing this. So we'll talk this morning about something that's very near and dear to my heart, and that is the role of supplements and nutrients in our practice. How many of you in here take a multivitamin, vitamin D, omega-3s? How many of you take that? Okay, so which makes my presentation very easy. Because when we ask that question to physicians doing grand rounds, speaking at other conferences where there isn't this integrative medicine mind, we get maybe 5%, 10% of people that raise their hands. So what I want to show you today is the science behind what we do, and for you to realize that there is real science behind all of this good stuff. So we work hand in hand with you. We give you information. We allow you to ask the right questions. And we give you right answers based in science. And for me, it really is a partnership. It isn't just taking a bunch of vitamins. It isn't. It isn't just taking a bunch of hormones. It's all of these pieces together. It's hormone optimization. It's vitamins and minerals that we put together. It's the food. I didn't say diet. I said food. I didn't say exercise because that's a dirty word. As soon as you tell somebody to exercise, they just start to sweat without even exercising. So I tell people to move. Get off your dupa. For those of you that are Polish, you know what that is. And I can say the word in a couple of languages. It's one of the words I know. And move. But there also needs to be that very, very important spiritual component to all of us. And I just added that in. This used to be just four circles here. And this has to be part of it. So that's what we're going to talk about a little bit today. So, and I think this is in a lot of your books. You can follow this along, but try not to look too far ahead because I like to surprise you a little bit. I've heard it said that by age 20, you have the skin that you've inherited. Right? When you're 20 years old, you have the skin. Everybody 20 has pretty decent skin. By the age of 40, you have the skin that you deserve. What have you done to yourself? Have you really beat yourself up? Because at age 60, you really have the skin you've earned. And this is all about, what do we look like? How do we feel? What does that outer self look like? Because it's what gives us who we are. There's a gentleman by the name of Hippocrates, 400 BC, said, "Let food be your medicine, and let medicine be your food." And I'll say that again. And the next couple of slides I'm going to show you are going to be, for me, upsetting when I was putting this together. But it's true. It's real. Let food be your medicine. Let medicine be your food. What was the problem with Hippocrates' statement? Today, he did not have the nutrient depletion in the soil. Hippocrates didn't have microwaves. Nobody should be microwaving their food. I just had a warming tray put in my house. It's wonderful. You don't need to have a microwave. For those of you that have grandchildren, children, please don't microwave their milk. Please don't do that. Don't be lazy. Put it in some hot water. Or warm it, if that's what you need to do. Don't microwave it. You're destroying all the nutrients, and I think you all know that. I don't need to tell you that. You probably know that innately. So don't do that. Hippocrates did not have the pollution that we have today. Hippocrates also did not have the multitude of medications, along with the drug nutrient depletions. The nutrient depletions from the drugs that we all take is horrible. I had the pleasure of interviewing Dr. Santiago many years ago when he came out with the study that said if you control diabetes, you will stop or halt the disease. My question has always been, why does the disease progress, even with a hemoglobin A1C of 5.6? My contention is that because of the nutrients that are depleted from the drugs, all of the oral hypoglycemics will deplete coenzyme Q10. Everybody thinks of the statins as depleting CoQ10, but it goes way beyond that. The SSRIs deplete CoQ10. All of the oral hypoglycemics deplete CoQ10. The beta blockers deplete CoQ10. So as these depletions happen, disease progresses, even with a controlled A1C. So here are some of the things that, for me, were very troublesome. Cows raised on corn rather than grass consume more calories and more omega-6s than omega-3s. We know that omega-6s in the wrong balance are pro-oxidants versus being antioxidants like the omega-3s need to be. The ratio of omega-3s to 6s needs to be 10 to 1. But in this country, we are eating omega-6s to 3s in the ratio of 10 to 1. This is why we have inflammation. This is why we have disease. And again, I'll show you more as we go on. Excuse me. And if you look at this, between 1985 and 2010, the high fructose corn syrup dropped 24% in price, and by 2006 in the US, children consumed an extra 130 calories. And I'm going to show you some data a little bit later about how deadly, how absolutely deadly artificial sweeteners are. Again, innately, we know it, but why do we keep drinking sodas? Why do we keep doing that? Why do we keep eating the sugar like we are? Last night we had a reception, and I absolutely love passion fruit. It's just something I grew up on. I was born in Sri Lanka, and we had passion fruit everywhere. I love it. And I don't know what it was, but it was absolutely delicious. It was like just a really light custard, and there was some fruit on the top. So a lot of the liaisons saw me eating dessert. I don't usually eat dessert. I usually eat some fruit. And I took some of the fruit off the top. I couldn't help but taste the passion fruit. I didn't eat the whole thing. There's nothing wrong with having a taste. There is a problem with eating a half a gallon of ice cream. Okay? So this is where it needs to happen. And we'll talk about some other things a little bit later. Look at this. Did you know, again, going back to what Hippocrates said, let food be your medicine, let medicine be your food. You'd have to eat a dozen bowls of spinach today to equal the iron content of one bowl of spinach from the 1930s. This is real. This is not stuff that I have made up. According to the Earth Summit report, farmland in the U.S. is 85% micronutrient depleted. The human body requires at least 60 minerals for optimal health, and only 8 minerals are found in high quantities in the food we eat today. So why do we have disease? Because the body is using so many accessory pathways to go through the metabolism that it usually does, going from point A to point B to make whatever happened, to make energy. It's not happening anymore because the body's now going from point A to point C to point B. And what's happening? Oxidation, aging, stress, stressing the body. In the past 80 years, iron found in apples has dropped 96%. Remember they were all saying an apple away keeps the doctor away? Absolutely. It's because of the pectin. Pectin in apples is cardioprotective. There is no pectin in apples anymore. So we wonder, and I say to doctors all the time when I do these presentations, do you take a multi? Do you take omega-3s? Do you take vitamin D? Do you take a probiotic? And they look at me and say, no, I get it from my food. And then my next question is, okay, how many of you, and not this audience, but how many of you, when I do grand rounds or when I talk to other physicians, how many of you ate 8 servings of fruits and vegetables yesterday? And you get a half a hand. Okay, what about the day before? Did you eat 8 servings of fruits and vegetables? The same half a hand goes up. So we wonder, so what happened a month ago? What happened 6 months ago? What happened a year ago? What happened 10 years ago? And we wonder why disease progresses, because we don't have the nutrients in our system to make the body do what it's supposed to do. The amount of calcium in lettuce has plummeted 92%. The amount of magnesium in cabbage has fallen 77%. I mean, these are significant numbers. 96%, 92%, and 77%. It's frightening. It's absolutely frightening. Journal of Complementary Medicine reports a 76% decline in trace minerals in the U.S. fruits and vegetables. And another gentleman by the name of Linus Pauling said that you can trace every disease and every ailment to a mineral deficiency. And we wonder why we have so much disease today. Why? It's the sweeteners, it's the preservatives, it's the garbage. Our body doesn't recognize this stuff. So as a result, what's happening? Oxidation is increasing. Our aging process. You know, disease is happening in 40-year-olds, in 30-year-olds. We see disease in children. Nobody should have asthma. Nobody should have asthma. Asthma, for me, is just one of those diagnoses that nobody should have. Fibromyalgia, it's a diagnosis of, I don't know what's happening, but we have a CPT code for it so we can bill for it. But this is what's going on. And I think we all realize this. And again, this audience, for me, it's a friendly audience, okay? But doing this type of a presentation, can you imagine, in front of traditional physicians? Once in a while I get tomatoes thrown at me. And I'm pretty good, I can catch them. So it's what's happening. So we're going to try to fix this. So why do you age? Why do you age? And I have my own theories as to why we age. For me, one of the contributing factors are the mineral deficiencies in our body. The deficiencies, for example, magnesium. 75–80% of the US population is deficient in magnesium. What happens if you're magnesium deficient? Tell me.
Problems with smooth muscle.
Problems with smooth muscle. So let's take that to the cardiovascular system. You have smooth muscle problems. What happens in the cardiovascular system? Arrhythmias. High blood pressure. Sorry? Bone density issues. Okay, so you have an arrhythmia secondary to a magnesium deficiency. You fall. You break a hip. What happens? You die. The mortality in people that break their hips, the elderly that breaks their hips, is extremely high. It's over 60%. So somebody comes into the emergency room, what are they on? They're on a statin, they're on a beta blocker, and they're on a PPI. And what do the PPIs deplete the body of? Oh, really? Really? But I'm going to give you solutions to this. And I think a lot of you probably know this, but I'm going to show you data to support the solutions. But do you see how this happens? So the mineral deficiencies, what about folic acid? What does folic acid deficiency produce? Right away, off the top of your head.
Spina bifida.
Well, spina bifida, right? But I'm talking about in the 50, 60-year-olds. Elevated homocysteine. Elevated homocysteine, cardiovascular disease. Homocysteine has a shearing effect on the vasculature, increasing plaque formation, and as a result, clots, heart attacks, and strokes. What about vitamin E? Vitamin E is terrible. Remember, vitamin E is bad for you. You should not use vitamin E, because if you take vitamin E, you are going to get a heart attack, and it does not prevent cancer. True or false? Why? False, why? Because when people ask you these questions, when doctors ask you these questions, you need to know the answers.
It's predominantly alpha tocopherol?
The studies used alpha tocopherol. The first study used alpha tocopherol. The second study used alpha tocopherol. The third, they wanted to do it again. So the third time they did it, they used DL alpha tocopherol, which is 36% less bioavailable and doesn't do, yes, the DL alpha tocopherol is a pro-oxidant, will increase oxidation, will increase your chances of having a heart attack, will increase your chances of having cancer. As my sons tell me, Dad, you're screaming. Stop. So I'm going to take a breath and bring it back down. I get very excited when I talk about this. But this is the problem. They used the wrong vitamin E. When you use vitamin E alone as D-alpha tocopherol, how many types of vitamin E are there?
4.
Who said 4? Good. Who said 8? Joe, stop. Joe can do this lecture. Joe and I have known each other for a long time. I learned everything I know from Joe. Well, some of the things, right, Joe?
Nothing in here.
Nothing in here. There are 8 forms of vitamin E. 4 tocopherols and 4 tocotrienols. God made spinach with all 8 forms, just as an FYI. So if I give you just the D-alpha tocopherol, your body's going to get depleted of the gamma tocopherol. And if your body gets depleted of the gamma tocopherol, you're going to increase oxidation. So shouldn't we just give everybody all of them, all 8 forms? And I wrote a letter to the people at Harvard and I said to them, I will provide you with the vitamin E, the right vitamin E, to do the study again. And we could have probably gotten funding. Never heard back from them. 2 letters. 2 letters. So this is what's happening out there. Calcium produces blockages in your blood vessels. Don't take it. Calcium is no good for you because you're going to have it depositing in the blood vessels. Okay, but maybe you should think about using vitamin K2 with that because it keeps it out of the vessels and it moves it into bone. So this is the problem. We have people doing studies who have no clue what they're talking about. Anyway, now that my heart rate's gone up and my cortisol level's up, that's okay. So mineral deficiency is another cause for me. Oxidative stress, absolutely. As we get older, as we oxidize, we're going to get older quicker. And what's oxidation? Rusting, aging, right? I love to use the analogy of 3 nails. We can put a nail outside in the elements, we can put a nail in the garage, and we can put a nail in the house. Which nail is going to rust the fastest?
Outside.
The nail outside, because of the elements, because of the pollution, because of the sunlight, because of the moisture. What about the nail in the garage? It's a little bit slower. And what about the nail in the house? It'll last forever because you're protected. A lot of us are probably between the outside and the garage. I want to move you into the house. That's what we as physicians need to do. We need to move ourselves and our patients into the house. That's what we have to do, and that's the analogy that people need to understand. And when you continue to drink that soda, and when you continue to eat your bonbons, and when you continue to eat those garbage pastries, you're destroying yourself. Think about that. Yes, I know I saw that. That's why I mentioned it. Sorry. People in the front row, I will pick on you a little bit. I like to see the oranges. I love to see the yogurt. That's what we need to do, folks. Be conscious. Be conscious. Make better food choices. You don't have to be perfect. You don't have to be perfect. Just make better choices. Once in a while, my weakness, love goldfish. Little goldfish, love them. I eat a handful of them every day. 1 handful. love them. And I don't know what's going to happen when, well, I'll save that for some other time before I get myself into trouble. Okay, so oxidative stress. And last but not least, what about toxins? Right, we have to talk about toxins. There are tons and tons of toxins out there. And what do? And I'll show you data on this. Toxins bind to receptor sites that don't allow vitamins, minerals, hormones to attach to those same sites because there's a competitive inhibition of these nutrients from the toxins. Lead, mercury, aluminum, nickel. You can give somebody all the iodine in the world you want, but if bromide and fluoride are in their body, we got a problem. So these are some of the things we're going to go over today. Let's start with iodine. I have to admit that I have been iodophobic. How many of you in here are iodophobic? Yes. Oh, come on. The rest of you are lying. Seriously. We're all been trained to be iodophobic. Iodine is terrible. Your neck is going to swell. You're going to look like a whatever. It's terrible. Don't use iodine. The reason I have so many slides on iodine, seriously, is because I was doing this to convince myself. And I did convince myself after doing the research and doing the work on this. So iodine deficiency has increased fourfold over the past 40 years. 74%, and I put this in quotes, healthy adults. What's a healthy adult? What is the definition of a healthy adult? I don't know. I'm just asking if anybody knows. If you know that definition, please give it to me. I'll use it and put your name up here. But 40%, in the past 40 years, 74% of our population of healthy adults are iodine deficient. And this is why we all have become paranoid. There's a genius by the name of the gentleman, Dr. Wolf, who did some research and gave iodine to mice and assumed that these rats developed goiters from the iodine, but never went back and checked them. And this is exactly what Dr. Donovitz was saying. And I heard actually Dr. Rosier saying this in the bathroom. I've heard that. I heard a person say, if it isn't science-based, we don't want to hear about it, because this is how problems begin. So iodine, I'm going to show you the data. The level of iodine in your body needs is 10 times higher than what is currently recommended in U.S. medicine. U.S. recommendation is 150 to 290 micrograms per day. Per day. And wait till we start talking about vitamin D and I show you some data on vitamin D and the problems that we have with vitamin D. In Japan, the land where people live the longest, they consume between 5,000 and 13,000 micrograms. I'm sorry, this is not an MEG, it's an MCG. Micrograms per day. 5,000 to 13,000 micrograms per day. What are we having in this country? 150 to 190. Look at this slide and what I have underlined. This is scary. I live in New Jersey. New Jersey has the highest incidence of autism in the country. The highest incidence of autism in the country. 1 in 25 children, boys. That's frightening. That is absolutely frightening. And I always think about the why. And I'm going to show you more data on autism and probiotics. And you look at me and say, what in heaven's name do probiotics have to do with autism? What do probiotics have to do with asthma? What do probiotics have to do with anything except, I don't know, it makes you feel good. But I'm going to show you the data. Look at this data. Study found that children with the autism spectrum disorder had up to 45% lower levels of iodine than controls. 45% lower. What about iodine in pregnancy? There is iodine in some of the Maltese, but what about, is that enough? The brain needs iodine. And again, I'll show you some more information on this. So, again, it's just something to think about. By the way, what do probiotics have to do with autism? What does gut health have to do with autism or depression or anything else like that?
Absorption of minerals and nutrients.
Mineral absorption. What else? Where's all the serotonin made in the body?
Gut,
No, it's not. It's made in the brain, right?
80% in the gut.
80% of serotonin is made in the gut. How many, honestly, how many of you knew that? Just a handful. The gut is responsible for serotonin. Serotonin, for those of you who may not know, is the feel-good hormone. Depression, anxiety, ADD, ADHD, serotonin, malabsorption of nutrients. It's amazing. It's frightening. But this, to me, is incredible. When I saw this study, I was absolutely floored. A Canadian study in the Canadian Journal found that 70% of patients given iodine supplements showed an improvement in fibrocystic breast disease. And I'm going to show you quite a few more slides on cystic disease and iodine deficiencies. How do I treat women with fibrocystic breasts, fibrocystic ovaries, a cystic uterus? I give them iodine. And guess what? In 6 months, the cysts have shrunken or they're gone. You don't need to be yanking out your ovaries and your uterus. Cystic disease in women, dense breasts, give them iodine. Give them some iodine. At least think about it. Giving somebody 6.25, 12.5 milligrams of iodine is not going to hurt anybody, because the Japanese are taking between 9 and 15,000 micrograms a day. I'm telling you to give them between 6 and 12 milligrams a day. There's data, there's studies to show that it is absolutely safe. Daily doses for optimal health is between 3,000 and 6,000 micrograms. It's between 3 and 6 milligrams a day. Have been used without any side effects in women that have cystic breast disease. Again, these are all referenced, by the way. In Japan, the consumption ranges from 5,000 to 13,000 micrograms per day. And if you translate that into milligrams, it's between 5 and 13 milligrams a day with no harmful side effects. And this is the reason for those past 2 slides, to show you that there's data to say that you can go up that high. Don't be afraid of it. Personally, I use around between 3 and 6 milligrams a day. And I personally take iodine. And again, all the references are there. So why do we all of a sudden have this iodine deficiency? Again, I know you have the stuff in front of you, but why did this happen all of a sudden? Over the past 30, 40 years. Why? Without looking at the slides.
Took it out of salt.
Took it out of the salt. Absolutely. So everybody now is using sea salt. Everybody's using all these other salts. They're great. They're loaded with minerals, but there's no iodine. There's no iodine. You know, I mean, there has to be a link, and I think the whole thing with ADD and ADHD and autism and cancer, it's multifactorial. It isn't just one thing, right? It isn't just iodine. But I really believe that this is a contributing factor to all of these things. So let's put another piece back into the puzzle. So the salts come out of the iodines come out of the salt. What else? Sorry? Less in food. I heard somebody else say something else. Bromide. What did they use instead of iodine to make bread? Bromide. Bromide is a toxin. It's toxic to the thyroid. So now we're eating bread with a substance, with a mineral that is toxic to the thyroid. So why have we had this explosion of an underactive thyroid or hypothyroidism in this country? Again, it's multifactorial, and I really believe that this is a big piece of it. So going to the next slide, there's less salt used. Why do we have this iodine problem? Less salt used, less iodinized salt used. Salt use in cooking loses up to 62.4%. There are kosher salts and sea salts. They don't contain any iodine. The vegetables, obviously, everybody's on a vegetarian diet today, as this gentleman mentioned. There's no iodine in these foods. And then if you exercise a lot, you will lose that also. You'll lose a lot of iodine. Human breast tissue and breast milk contain higher concentrations of iodine than the thyroid gland. Now, did you know that? I didn't. And as I look through this data, it's incredible. Breast tissue and breast milk have more iodine than is in the thyroid. In fact, 30% more, much more. So what do babies need for growth and development? Brain function. Besides omega-3s, iodine. But where does the baby get it from? Mom. What if mom's deficient? The baby doesn't get it. Breast tissue is rich in the same iodine-transporting proteins as the thyroid gland. Iodine is essential for the development of the baby's brain. And the only way for the baby to get it is from mom. And if mom's deficient, baby is going to be deficient. We were here a month ago, and on the way home, my son has an app on his phone that talks about, well, I'm going to be a grandfather, and my daughter-in-law is here, so she's going to strangle me after I'm done speaking. I get one mention, Jill, and after that I'm in trouble. But my son is in the back of the room, and we actually work very closely together, and his wife is with him, and Jill is pregnant. She's 4 months pregnant. And last month, on the way back, Derek showed me, my son showed me the app, and it said, this week, I think it said this week, the mom needs to eat iodine-rich foods for the baby's nervous system development. I just got done speaking about iodine. It was on an app that he had. So people are becoming more conscious of this stuff, all right? And we need to become much more conscious of this. Chemicals, the presence of chemicals and enzymes found in breast tissue. Iodine has been shown to be a very powerful antioxidant, more powerful than vitamin C. It's an antioxidant. It makes sense, right? It absolutely makes sense. Bless you. Iodine deficiency, breast tissue exhibits chemical markers of elevated lipid peroxidation. Again, oxidative issues. And when we talk about oxidation, what do we talk about? Cancer, right? We talk about cancer. So iodine, again, for breast tissue, for breast cancer. And I'll show you more data on this. Alterations in DNA, coupled with iodine deficiency, increases circulating estrogens. And changes substantially increases women's risk of breast cancer that have low iodine levels. Shouldn't we just start giving women a little bit of iodine? If you have risk, even if you don't have risk, why not? What do you have to lose? Remember, you can take up to 13 milligrams a day. That is 13,000 micrograms a day. So take it. Use it. The link between breast cancer, and this is really interesting. Japanese women consume a diet that is very rich in iodine, seaweed. Provides them with an iodine intake 25 times higher than the average American woman. But what happens is, as soon as they come to the US, their risk of cancer goes back up because their diet changes. It's the same with the Indian subcontinent, India, Sri Lanka. People come to the U.S., Pakistan, they come to the U.S., low level of heart disease there, come to the U.S., just goes right back up. Why? Well, because all the fast food restaurants are there. It's a treat to go eat a hamburger. No, it isn't. You're killing yourself. It's a treat. When I saw this report about, I don't want to say the company because it's being recorded, the soft drink with all the sugar, starts with a C, introduced to Africa. The people were working to buy a bottle of soda. What are we doing? What are we doing? Why don't we just send them water? Why don't we just send them water? Water, by the way, is a lot more expensive than a can of soda today. We all know that. Iodine given to cancer-prone rats cut mammary tumor rates nearly 2.5%. Breast cancer cells just suck up the iodine, which suppress tumor growth. And folks, there's references all here, okay? I'm not just making this stuff up. There's references in all of these. Adding iodine, the dose of iodine used in these studies were substantial. They're equal to 5,000 micrograms a day. Selenium. Love selenium. Selenium converts T4 to T3. Studies from the University of Arizona with selenium and prostate cancer, love it. 100, 200 micrograms a day of selenium added to the thyroid, added to some iodine, you're golden, ready to go. Selenium is a very important cofactor for iodine, not only in the breast tissue, but also in the thyroid. Fibrocystic disease, as I told you before, I use this in my patients, 3,000 to 6,000 micrograms a day. What about iodine in the heart? LDL, oxidation. Dropping LDL cholesterol. My LDL cholesterol, since I've been using iodine, has gone down about 15 points. I haven't changed anything else. The only thing that I've added is the iodine. And I've seen substantial improvement. Hypothyroidism, I think you all know this. This is easy. And the heart. What about this? Stomach cancer. The lining of the stomach, the lining of the intestines contain receptors for iodine. And they have a very potent antioxidative effect on the lining of the intestine. Really, really fascinating information here. So a poor man's test for iodine, if you don't want to do a blood test, go to one of the pharmacies, buy a small bottle of iodine, get a ball of cotton, rub it on your skin. Make about an inch or a 2-inch circle on your skin. How long should that last? Greater than 8 hours. If it lasts greater than 8 hours, you're not iodine deficient. If it sucks up in 2 or 3 hours, you're iodine deficient. Start taking it. Chances are that you're going to be iodine deficient. There's no question. There's no question. We did it with a lot of the liaisons here last time I was here. I think there was one person who, out of maybe 20 people, that the iodine that stayed as long as it should have. Okay, so it's a really cool test that you can do on yourself and do with your children even. So, again, don't look at the book here if you can. How do you know if you're iodine deficient? Clinically, physical exam. We don't have a blood test. We don't have a serology lab. What do you look for in physical exam? Don't look down. Very simple. And I'll bet you anything that you guys see this all the time, and you didn't even know what it was. Scalloping of the tongue. Scalloping of the tongue. A normal tongue, the outer edge of the tongue is smooth, right? Should be very smooth. But with people that have iodine deficiencies, what happens is now everybody's going to start looking at each other's tongue. It's okay. You can do a quick physical right now. The outside of the tongue is scalloped. The border gets scalloped. So you have almost like these cuts and ridges on the outside of the tongue. That, folks, is an iodine deficiency. I know you have seen that. in practice. If anybody in here is on thyroid medicine, if you're on thyroid medicine, I'll bet you that you have scalloping of your tongue because you have an iodine deficiency. And for those of you who think you're hypothyroid, you will have scalloping. You have to know what you're looking for. It is very subtle. In some people, I have a picture actually I took of one of my patients. It was way too ugly, and I couldn't even look at it. I didn't put it up. But it was very obvious. I point this out to my residents and medical students all the time. All right? So look for that. You all know what I'm talking about, right? That scallop border of the tongue. I'll have to put a picture up here that's not as ugly. But that's one thing. So let's go through that. Signs of hypothyroidism. The other thing you need to look at is when you're examining a patient, have them look directly at you. Have them look directly at you. And you will notice that their eyes, the pupils, one of them will slightly move medially, will slightly move towards the nose, okay? Because they both should be set midline. But if you start to see that one of the eyeballs, if you will, is moving a little bit more medially, that is an iodine deficiency. And there clinically could be hypothyroid. The other thing, and I'll never forget, I've known this for 26 years, 30 years, the delayed relaxation response, right? When you hit somebody's, when you hit somebody's Achilles, what happens? Up and down. It's up and down. Up and down is normal. But if you have a delayed relaxation, that is a clinical sign of hypothyroidism. How many of you check that? We need to do that because these simple clinical signs are important. The other thing you look at, because there's a relationship between the thyroid and the adrenals. So if you have high cortisol, you will start to get reddening and erythema of right around the bridge here. There'll be some redness right through here. That is the connection between the adrenals and the thyroid. And last but not least, I always check iron profiles. I always check iron profiles in people that are hypothyroid to make sure that they're not iron deficient. I see this all the time. All the time. So again, something for you to look at. Bromide. Bromide is a toxin. It's a class 2B carcinogen. The FDA, this Center for Science and Public Interest has petitioned the FDA to take it out of our foods, but nothing's been done. It's toxic to laboratory animals. It is banned in the UK and in Canada. But, you know, we're more worried about drugs here, so let's not worry about bromide. Fluoride, again, some research and data to show you that higher levels of fluoride in drinking water provided a useful contribution for predicting prevalence of hypothyroidism. Twice as likely to develop hypothyroidism if you have fluoride if you're drinking water. By the way, fluoride, chlorine, they're xenoestrogens. They will displace estrogen and they will preferably bind to those receptor sites. So getting that garbage out of your system is critical. And this is, again, where iodine comes in. Perchlorate is ubiquitous. It's all over the place. Decreases utilization of iodine even further. It was originally developed for explosives and rocket fuel. It is now found in the groundwater. And here's the best part. It's even used as a flavor enhancer in certain foods. What is wrong with us? Seriously. I mean, don't people know this? There's data. Why are we still putting this stuff in our food and in our water? Again, more information on perchlorate, you can read that. What about gluten? This was very interesting. Have you seen people that have urticaria? They come in, they're itching, you can't figure out why they're itching. Right? You send them to a dermatologist, IgE is normal. You do the blood test, dermatologist says, I don't know what's wrong with them. I'd never found a dermatologist that knew what was going on. I hope there are no dermatologists in here. Unbelievable. Most of the time, these folks have a couple of different things going on. If your body is itching, what are some of the questions you need to ask? Are you dehydrated? What else? What are you eating? The skin is the largest organ of elimination. What are you eating? Do you have a tinea corpus? Do you have a tinea versicolor? Do you have jock itch? Do you have athlete's foot? Those are all tinea infections, and it's going to itch. You compound that with a gluten sensitivity. You compound that with an iodine deficiency, and you're going to be itching. Believe it or not, how I treat these folks is I change their diet, give them a probiotic, and give them iodine. And they get better. Instead of putting them on a Medrol dose pack and making it worse. What happens when you put somebody on a Medrol dose pack and they've got a leaky gut or they've got some dysbiosis? It makes it worse. They get better for a week and then they stop and it comes right back. It makes it worse. So antithyroid antibodies, as many as 57.4% of patients with hives have the presence of antithyroid antibodies. Think about that. Look at that. And don't start chasing the antithyroid antibodies, all right? And Dr. Donovitz and Dr. Rosier and I, we've all talked about this. Just fix the gut, and this will improve. This is one of the tests that I follow for people who say, no, I'm eating really well. No, you're not. Why are you lying to me? You know you're lying to me, so stop it. And they do, and you tell them. And this is how I treat them. I don't treat them with just T4. It doesn't work. And I have to tell a quick story about this. I have known and I've seen the folks from Nutraceutical, from RLC Labs for years, and Ricky will tell you that. I've seen them at every conference. I've been the chairman of AMMG for the Age Management Medicine Group for 8 years, 10 years. She's been at every conference. Walk by her booth and say hi to her every time. Never used the Nutraceutical. Never used it. Just, I don't know why. Over the past 6 months, I have switched all of my patients. And by the way, they're not paying me to say this. They're not paying me. So, just as an FYI. I have switched my folks over to Nutraceutical, and it's amazing the results I've had. I cannot believe that I didn't do that. The combination of T4 and T3, I think, is extremely, extremely important. All right, so just pay attention to that. Again, my suggestion here is T4 and T3. Very quickly, interactions with thyroid medications. Calcium, iron, calcium, PPIs, estrogens, and statins. Statins is on every conceivable list of interactions that there can be. Let's talk about DIM. Very quickly, this is very simple. From cruciferous vegetables, connection between DIM and hormones has to do with estrogen. It, again, very simply, making estradiol, making good estrogen. And I want to go through this. Again, you can read a lot of these. It's due to the imbalance. And again, reading the underlying supplemented diet with DIM specifically promotes beneficial estrogen and helps restore healthy hormonal balance. But here's what we really need to look at. The bad guy is the 16-hydroxyestrogen. The good guy is the 2-hydroxyestrogen. And that's exactly what DIM does. It makes the good guy and doesn't allow the bad guy to happen. It's that simple. Again, 16-hydroxyestrogens can result in mutations, abnormal growth, such as cervical dysplasia, and increased risk of future breast cancer. How do I treat cervical dysplasias? What do we give them? What should we give them besides DIM? What other nutrient? And I've done this for 15 years, and it's worked. Folic acid. Folic acid. Great studies, great data on folic acid in treating cervical dysplasia. You've got a grade 1, grade 2, abnormal. Give them a milligram to 2 milligrams of folic acid. Rebiopsy them, relook at them in 6 months, and you will see results. You will see improvements. Again, the benefits of DIM, the 2-hydroxy metabolites is what you're looking for. Vitamin A, and again, we're going to go through this very quickly because it's related to the ADK. You will not get toxic with vitamin D if you use vitamin A. And we're switching over to ADK right now. All right? You will not develop a problem. How many of you have seen patients that have the bumps, and you may have these yourself, bumps and lumps on the back of your arm, right back here. It gets bumpy, it gets lumpy, it's ugly. You don't want to put that bathing suit on. You wear a long sleeve shirt. You know what that is? It's a vitamin A deficiency. It's a vitamin A deficiency. Start taking vitamin A, and that's going to go away. Absolutely, absolutely. Vitamin D. Vitamin D is, how many of you know your vitamin D levels in here? Okay, for those of you that don't, you increase your risk for all cancers by 40% if you're vitamin D deficient. Let me say that again. You increase your risk for all cancers if you have a deficiency of vitamin D. I apologize. So if you have a vitamin D deficiency, you increase your risk for cancer by 40%, and you increase your risk for heart disease by 60%, and I'll show you the data. So it's for those of you that don't know your vitamin D, get it checked. And a deficiency for me is anything less than 40. You need to be in the 50 to 60 range. So this is a really cool slide. Vitamin A and D3 are the base. Vitamin D is the guy smiling at the camera. Vitamin A is the brother with his head between vitamin D's legs. His face is obscured and his role is not clearly defined. Take that for what it's worth. And vitamin K2 is the brother that's on top. And everything would fall flat on its face if vitamin K2 was not there. K1 is phyloquinone, K2 is menaquinone. That's what we need, menaquinone. So can you take vitamin K if you're on Coumadin? Yes. Which kind? There's 3 kinds of vitamin K. Which kind can you take if you're on Coumadin or a blood thinner? 2. K2, and that's what's in our ADK. It's K2. No problem, no interaction with Coumadin or any kind of blood thinners at all. Coumadin, warfarin, any of them. No problem. So, again, don't look down. Very quickly. How do you know if you're vitamin D deficient? What are some of the things you look for? Doctors, nurses, what do you look for? Besides the blood test. That's cheating. That's cheating. Folks, because remember, you may not always have a blood test. Most of us do, but if you don't,
Typically we don't know until it's too advanced.
you don't know until it's advanced. You're absolutely right. That's where the deficiency comes in, right? But what are some clinical things you need to look for? Clinical things that you can see on physical exam. What do you, just like with the thyroid? No, not hair. When you're doing a blood pressure, how many of you, and I guess this is for, I take my own blood pressures. I don't let my nurses or my ancillary staff take blood pressures. I take my own blood pressures with my patients. How many of you that have taken blood pressures, and this is probably for the support staff, have taken blood pressures, and the patients will say, ouch, you went up too high. You all remember that, right? Even some of the physicians. What is that? That's a vitamin D deficiency. Could be. It might be zebras out there. That's a vitamin D deficiency. That's why I check my own pressures. So when you check a blood pressure, please make a note. You don't have to make a note on the chart. No, it's a legal record and the whole deal. Tell your doctor that you're with, the patient did an ouch when I got to 180 millimeters of mercury. That's a vitamin D deficiency. The other thing we as physicians can do is press on the sternum. You can press on your sternum. Does it hurt? If it hurts, you got a vitamin D deficiency. Anterior tibial area, press. Does it hurt? Vitamin D deficiency. Okay? So those are three things that you can look at as far as vitamin D deficiencies for on clinical exam, on physical exam. Pressure on the sternum, inflating the blood pressure cuff, and that's it. How many types of vitamin D are there?
8.
You sound like the guy on Dancing with the Stars.
There's 3.
8. There are vitamin D, there's 5 kinds of vitamin D. 1, 2, 3, 4, and 5. 2 and 3 we can make. We can give you. Don't take 2. It's useless. Take D3. 1, 4, and 5 come from the sun. So this is why a little bit of sunlight is important. So who's at risk? Dark-skinned people, hospitalized people, institutionalized people, higher latitudes, obesity, and the elderly. Right? For people that are in nursing homes, you've got a nursing home practice, please make sure that those people go outside 5 minutes to get some sun. So, yes, sir?
You're saying don't prescribe D2?
Correct.
The prescription form?
Mm-hmm. Absolutely. D2's got to get converted to D3. Why do we need to give our body an extra step? Also, giving 50,000 IU of vitamin D2 in a one-time dose is very, very difficult for the body to do what it needs to do. And the vitamin D2 does not come with A and K. So, the toxicity issue becomes an issue. The toxicity becomes an issue, even though you're deficient. And taking it it's like taking 50,000 IU of vitamin C. Your body can only utilize so much at one time. Give it in smaller divided doses, 5,000, 10,000 IU. But here's what's really interesting that I'm going to show you in this group of slides. This is very interesting. Vitamin D3 and omegas. Previous research has demonstrated that vitamin D helps regulate the conversion of tryptophan to serotonin. Again, I'm coming back to serotonin. So there are 3 things that I've mentioned with serotonin. What are they? Iodine. Now we're talking about vitamin D and omegas and probiotics. Actually 4 things. Folks, these are all related. You got to know your vitamin D levels. They're critical. Again, why do you feel good? Vitamin D is, what's sunshine? Sunshine is vitamin D. Why do we feel so good when you go to the beach and you take your shoes off and you walk in the sand? That's another whole thing that we can talk about at some other time, but it's called grounding. I know a lot of you, when I first mentioned this to my sons, they both said, "Dad, there's something wrong with you. There's something seriously wrong with you." But today, they still say that, but they believe me a little bit more. Vitamin D and omega-3s, once again, EPA helps increase the release of serotonin from the presynaptic neurons by reducing inflammatory signaling molecules in the brain. We know about E2 prostaglandins. That's where EPA works. DHA works, and again, this is moving around a little bit. DHA works by helping make several serotonins more accessible, and they work in the postsynaptic area by increasing the fluidity. So EPA and DHA are always together, right? We see it together all the time. EPA in the presynaptic, DHA in the postsynaptic. Actually, that side is in the wrong place, and I apologize for that. Vitamin D and MS. I was at SeaTac Airport. Any of you from Seattle? I've been to Seattle numerous times. I used to do some business there. At SeaTac Airport, right outside the Marriott, there was a restaurant down the street called 3 Coins that I used to go and eat dinner at. There was a huge billboard that said, "You are in an area where there's the highest incidence of multiple sclerosis in the country." What was that? A vitamin D deficiency. Look at this. Participants, sorry?
Rain so much in Seattle.
Sorry? 285 days of rain. There is no sunshine in Seattle.
I watch a lot of great
You know, so Participants were white women. This is a study, this is data that I believe is just going to be, was just reported, were women ages 18 to 60 with 25 dihydroxy vitamin D levels of 30 or less and a BMI of 30. When they compared these folks, they also had all kinds of other mineral nutrient deficiencies. Compared to the other population, these women, the multiple sclerosis, there were so many other nutrient deficiencies. Why are we developing disease? We're developing disease because we don't have the right nutrients. The body's having accessory pathways that is producing the disease. This has to do with the nutrients, as far as I'm concerned. It's nutrients and hormones, and it's all of this stuff. Skeletal muscles. If your vitamin D levels is where it should be, your risk of falling decreases. And this was a study that was done in the elderly, in nursing homes. If they had good vitamin D levels, their risk of falling had dramatically decreased. Give them vitamin D. What's the big deal? Vitamin D in cancer has apoptotic and anti-angiogenic effects. What's apoptosis? Apoptosis is programmed cell death. What did I say to you? If your vitamin D level is low, you increase your risk of cancer by 40%, because if you don't have appropriate vitamin D, you can't kill abnormal cells. Apoptosis is the body's ability to destroy abnormal cells, cancer cells. And it also will prevent new blood vessels from forming if you have cancer. All right? So this is how it works with regard to cancer. This is another study that was done, a mortality study. This is what I just talked about. Another study on cancer. Look at this. This really blew me away. Women with low levels of vitamin D, less than 50. Less than 50. So 31 is not normal. All right? The reference range is 30 to 100. Whoever made that up is out of their mind. But anyway, less than 50 were 6 times more likely to develop breast cancer than those who had a level greater than 50. Folks, just take it over 50. What's the big deal? What's the big deal? Also with telomeres, telomerase. You live longer if you have appropriate vitamin D levels. That's what this is saying. And I don't want to go into, again, women with low levels of vitamin D lived longer. Okay. I sent this to Dr. Donovitz this week, and he said to me, "Are you going to talk about this?" I said, "Absolutely. Look at this. I just read this. I just put this slide in. This is not in your slides. And there's references here, by the way. They have underestimated the calculation. This was a miscalculation, and they underestimated the dosing of vitamin D by 10-fold. There's two references there. And now they're trying to get these levels changed. The recommendation is for children 5,000 IU a day. 500 IU a day. And for adults is 800. They miscalculated by 10-fold. So now the recommendation should be between 5,000 and 8,000 IU a day. How long have we all been saying that? Right? I mean, come on. Here it is. I'm getting goosebumps as I talk about this stuff. Because I've been talking about this for 26 years. And finally, some people are starting to listen. Like all of you in this room. So, how much is enough? When it comes to vitamin D, how do you dose vitamin D? Because the biggest issue is, God, you're taking 10,000 IU a day? Doctor, isn't that a lot? Well, no. If your level is 10, you probably need more. So, how much is enough? What do you tell your patients? Until your level's right. Absolutely. If I need to give you 10,000 IU or 15,000 IU and get you into the 50 to 60 range, so be it. But as soon as you get into that range, we'll drop you down to 5,000. No problem. What's the big deal? So it isn't how much, it's where do we need to get you to? Okay? That's the key here, and that's what's really important when it comes to vitamin D. I've had the pleasure of speaking with and talking with Dr. Michael Halleck. He actually is seeing a patient of mine right now that I'm going to be presenting a case of a vitamin D, a 25-hydroxylase deficiency in a patient of mine that was absolutely fascinating, and I sent to Boston for Dr. Halleck to see. So again, I'm going to be presenting that case in 2 weeks in Orlando. And Dr. Donovitz will be joining us. He'll be there, and BioT is going to be a huge part, is going to be a really huge part of our conference. So again, if you'd like more information on that, we can talk about that. So vitamin K, we'll switch over to vitamin K. It's actually fat-soluble. K2, we went over all of this. Menaquinone is what's important. 98% of the population is K2 deficient. So here we go. The deficiencies. K2, 98% of the population is deficient. So let's give people bisphosphonates. Right? We'll give you those things that's supposed to fix your osteoporosis. They don't work. You increase your risk of fractures just by taking those awful drugs. What does K2 do? K2 moves calcium into bone. It rebuilds the bone matrix. It helps calcium. That's how you rebuild the matrix, by giving people K2, not by giving them bisphosphonates. And this is why we have ADK. While you're giving them the D, you're giving them the K2 and you're giving them vitamin A. Vitamin D, 75%, 80% of the US population is deficient. If your skin is dark, it's 90 to 95% of you have a deficiency. In my practice, 100% of my patients that have been diagnosed with cancer have had a vitamin D deficiency, defined as a number less than 35. 100%. I showed you the data on apoptosis and antiangiogenesis. It's for real, and I did this in my own practice. I've been checking vitamin D levels for 20 years. 20 years I've been checking vitamin D levels. Iodine, 74% of the population is deficient. Magnesium, 75% of the population is deficient. Why do we have disease? What's going on? It's unbelievable what's going on. What's going on is that we're not paying attention. And all I'm asking all of you to do is to start paying attention. Pay attention to what you're putting into your mouth. Be conscious of what you're eating. Be very conscious. I'm not asking you to be perfect. I'm asking you to be conscious of what you're doing. And we need to talk to our patients about this also. And folks, I'm going to say this again. This isn't about the money, okay? It isn't about the money. Are you going to make money doing this? Yes. But you know what? At the end of the day, when patients come back to you and say to you, Doc, I feel great. The slides that Dr. Donovitz showed of that lady who drives 6 hours to come to see him. I get goosebumps when people tell me that. And you know what that does for me? It raises my serotonin level. I'm serious. It boosts my immune system. And those are actual studies. Herbert Benson, Harvard University, Spirituality and Healing is the name of the conference, where they presented that data. It's for real. If we don't give a darn, we need to get out. If you're tired of it, get out. Find something else to do. But if you still care, and obviously why you're here, we have to make a difference. We have to give a darn. And once we do that, you don't need referrals from other doctors. 85% of my referrals come from my patients, from other patients. Why? Because I sit there and talk to them. I'm tough with them. You got 3 to 6 months to get off your dupa and do what you're supposed to do. If you don't, I'm done with you. 80% comply. 20% go away. Out of the 20% that go away, a significant number come back. Because I care, and we have to care. Because if you don't care, move on. So, again, this is how vitamin K works. And you can read this. I need to move on here. And I explain this to you. Rebuilds bone, benefit for the vascular system. And again, bone mass decreases as we get older. We know that stuff. In Japan, treating osteoporosis, K2, 360 micrograms a day. That's a treatment for osteoporosis, not bisphosphonates. And it works.
How much did you, 360?
Sorry? 360. We have 500 micrograms in our ADK, so not to worry. I love this slide. I stole this slide from Dr. Donovitz. We don't look at the patient. How many of you, and I hope none of you do this, but we don't even make some doctors don't even make eye contact with their patients. And they walk out of there and they just, what happened? Did I just see somebody? Look at the patient. Look at the patient. Don't look at the numbers. You need the numbers, but look at the patient. Okay, now for my favorites. And this actually was, I was going to put these in the beginning, but I really like this, and I usually start my presentation with this. Open your eyes, open your ears, and open your brain. Because if you don't do that, you're not going to absorb, you're not going to see, you're not going to hear. There's a difference between hearing and listening. There's a difference, and we do have to care. So, let's go into the human microbiome. This is my absolute favorite thing in the whole world to talk about next to my grandbaby-to-be. Okay? So, we were joking the other day. I've had my mustache since 1975. And I said to my office manager, I'm going to shave my mustache. She said, Dr. DeSilva, I don't like facial hair in general, but you need to keep your mustache. Said that to my son, both of my boys, and my younger son said, Dad, I don't know. 26 years, I've seen you with a mustache. I don't know if I could handle it. So I'm going to freak him out one day. And then my daughter-in-law said to me, okay, in order for you to come and see the baby, you got to shave your mustache off. I said, done. She was joking, I hope. But anyway, it's one of my favorite things to talk about, not my mustache, the human microbiome. What is the human microbiome? It's a mixed community of genes from the mixed community of bacteria, and the genes that they contain. In the early 2010, the EU published a census, and what they showed was that there are 3.3 million genes from more than 1,000 species of bacteria, which is 150 times the amount, which is 20 to 25,000 genes in the human genome. The human genome, the bacteria outnumber our cells by 10 to 1. It is incredible to me that I have been talking about this for 25 years. I have been talking about probiotics. In fact, I can't tell you, the meteorologist at our our TV studio teases me all the time. His name's James Gregorio. He teases me all the time about probiotics because that's all I've been talking about for 15 years that I've been on television. It is so incredibly important. And you know what? Thanks to Erin Andrews, everybody knows who Erin Andrews is, ESPN reporter, really cute, blonde hair, right? Thanks to Erin Andrews and Jamie Lee Curtis and Kathy Rigby for bringing probiotics to the forefront. Completely fine with that. If that's what we need to do to get the information out there, I'm in. Because that's what they've done. If you don't have the right flora in your system, you are not going to be healthy, period, end of story. It all starts in the gut. You've heard the old saying, and by the way, I have to give Mark Hincher, I don't think he's in this room, but I have to give Mark Hincher credit for this. I said to Mark one day, we were in the car, we were talking, I said, you are what you eat. He said, Doc, sorry to disagree with you, but you are not what you eat. You are what you absorb. Why? You can have the best diet in the world, but But if you're not absorbing those nutrients because you don't have the right flora, it ain't working. It ain't working. How many of you in here eat don't raise your hand, you'll give me chest pain. How many of you in here eat processed food? How many of you in here eat the muffins and the donuts and the bagels? Don't eat that stuff. Just don't eat that stuff. It's not healthy. Leave it under the napkin.
I know.
I saw you looking at that. Because you know what? That stuff talks to you.
She said, you have one. I said, yeah, but I didn't touch it.
That stuff talks to you. All right? They also serve you, people also serve us toxins like soda. Do you need to drink them? This is where choice comes in. Free will. This is where decision making comes in. Okay? Not busting anybody's chops here, seriously. It's all about the gut. And you'll hear a song tonight. You will hear a wonderful thing tonight, a presentation about that it's all about the pellets. We can do a little preliminary thing about that. Gunther's in here, but you'll have to wait for tonight. It's part of our entertainment. Okay? So, for me, it's all about the gut. So when you hear this tonight, I want you to change the word pellets to gut. Anyway, we'll talk about that later. So what are some disorders, don't look at your book again, that are linked to having poor gut flora? Real quick. IBS. What else? Colitis. Absolutely. What else? Cardiovascular disease. It affects every single organ in the body. If you don't have the right flora, what happens to you? IBS, Crohn's disease, ulcerative colitis, heart disease. ¿Qué más? Diabetes. Very good. What else? Cancer. So you're telling me that if you don't have the right flora, that you're going to get cancer? How does that work? You have leaky gut. What else? What about depression? What about autism? What about ADD? What about ADHD? Remember, 80% of serotonin is made in the gut. Right? We need vitamin D, we need iodine, and now we're talking about probiotics. We're also going to talk about omega-3s. IBS, depression, Alzheimer's disease. Really? How does that work? Alzheimer's disease and not having a good gut? How does that work? Tell me.
Poor absorption of magnesium, which leads to elevated homocysteine, which causes swelling and inflammation in the brain.
Absolutely. Poor absorption of magnesium that produces, elevates your homocysteine, that leads to all kinds of other problems. Folks, you can eat the best food in the world. You can eat the best organic food in the world, but if your gut is no good, it's not getting absorbed. You're wasting your money. You're wasting your money. Autism. This really scares me. This really scares me. Fibromyalgia, right? We as physicians know, I don't know what's going on. They've got joint aches, body aches, headaches, fatigue. They have upset stomach. Every single fibromyalgia patient has GI problems. Remember from medical school we were taught that if you've got gut problems, ulcerative colitis, Crohn's disease, what manifestations do you also have? Psoriatic arthritis, joint problems. What is that? Leaky gut. And I can do a whole presentation on the membranes and the leakage and the proteins, and we can get into that sometime. In fact, I'd love to talk about that one day. But it all has to do with healing the gut. MS, diabetes. So, the human intestine contains 100 trillion organisms, 4 pounds of body weight. Some people have a little bit more than 4 pounds of our body weight, which are bugs, which are not good. But they have an effect on the immune system, digestion, vitamin production, and detoxification or elimination. Folks, if you have gas, belching, bloating, or burping, and you can't poop, you got a problem. You got to poop. You have to poop. Because if you don't, what's happening? You're going to stink, and people around you are not going to want to sit next to you. at work, right? What happens if there's a dead animal outside your door? It decays, and what happens when it decays? It smells, it stinks. And what happens when the food that you eat stays in your system? You reabsorb the toxins. That's exactly what happens. You got to eat, it's got to get digested, and you got to poop it out. So if you don't have a bowel movement every day, some people 2 a day, sorry to talk about this, but it is what it is. You got to poop. How many times a day does a baby poop? Numerous times a day. My son told me he cannot wait to change diapers. He said that's going to be his job. Right, Jill? That's exactly what he's going to do, is change diapers. When my son was little, he used to start throwing up because he didn't like the smell of his own poop. I don't know what he's going to do. I can't wait to see this. This is going to be hilarious. So detoxification, folks, really important. By the way, don't forget about the liver. Don't forget about the liver. If you've got somebody that you're giving probiotics to and they're starting to detox, right? Their symptoms start to get worse. Their gas gets a little bit worse. Their belching and bloating get a little bit worse. Take a day off from work first. Okay, take a day off from work so you don't smell out your entire staff. But after that, don't forget your liver, because those toxins are also going through the liver. Milk thistle, schisandra, N-acetylcysteine, glutathione. Really important for you, all right? Because they have to clear out of your system. For the liver, yes. Milk thistle. Again, you can use any one of these. You don't need all of these. Milk thistle, schisandra, S-C-H-I-S-A-N-D-R-A. It's one word I can spell. NAC, which is N-acetylcysteine, or glutathione. Again, all wonderful cleansers and cleaners for the liver. All right, so what kills the good bacteria? Besides antibiotics. Don't look at your list if you can. Real easy. You guys have this stuff in front of you, so I'll go through it. Steroids, chlorinated water, oral contraceptives, antacids, high sugar diets, and diets high in processed and refined foods. So, a patient comes into you. Patient comes into your office. They've got gas, belching, bloating, burping. They're constipated, and they're on a PPI. What are you putting them on? You're putting them on a probiotic. It is my number one recommendation for better health. Okay? Every single one of you in this room, how many of you take a probiotic? Wow. Really? You guys are good. How many over here take a probiotic? Okay, this is kind of the side that's a little shaky, that's eating all that stuff over there. Take one. Take one. Take a probiotic, because your immune system, your digestion, your elimination, your vitamin production all starts in your gut. It all starts in your gut. Every single one of you, every single one of your family members, and every single patient you see needs to be on a probiotic. It is critical. They need vitamin D levels, they need iodine, they need a probiotic, but it starts with a probiotic. Why? Because it's absorption of the nutrients. It is the only thing I use during chemo or radiation. During chemo and radiation, not a problem. Not a problem. Pre and post-op, not a problem. At all. But if you've got any kind of skin issues, psoriasis, eczema, what is that? It's your diet. It's the sugar. The skin is the largest organ of elimination. And very quickly, how do I treat people with psoriasis and eczema? I open up the capsule, I make a little paste, and I have them apply it to the area. How do I treat women with vaginal yeast infections? Besides running away from them, what I do is I open up, don't choke on your water back there. I open up the capsule, I tell them to make a little paste and apply it to the area. All you need to do is reestablish the flora. That's what you need to do. How do I treat babies with diaper rash? I don't see babies, but what do I recommend for babies with diaper rash? Make a little paste, rub it on the butt. How do I treat women that have diabetes, that have itching and erythema underneath the breast? How do I treat jock itch? Open up a capsule, make a little paste, and apply it to the area. In a week, it's gone. That's how you treat. Don't give them a bunch of steroids. It isn't going to work. It isn't going to work. It's going to suppress the immune system and everything's going to come right back. So, 60% of your immune system, Erin Andrews says 70, so we'll go with Erin Andrews. She says 70% of your immune system resides in your intestine. Digestive system, it breaks down all our foods. B vitamin production, it makes all the B vitamins. Many years ago, I made this statement, published in a magazine called Nutraceutical World, that there's a connection between gut health and heart health. This was 20 years ago. I got mail coming back to me saying, DeSilva, you're out of your mind. I still have the journal. I said, you're out of your mind. What does that have to do with anything? It has to do with nutrient absorption. If you're not making folic acid, if you're not making your B vitamins, you're not going to have the right nutrients and disease is going to progress, specifically heart disease. Again, homocysteine. Detoxification, the skin is the largest organ of elimination. I can look at your skin, I can look at your tongue, and I can tell you what the rest of your intestine looks like. Look in your patient's mouths. Not only are you going to see the scalloping of the tongue, but you're going to look at their tongue, and you're going to see that they have this white, ugly coating with the papillae that are hypertrophied. That is an overgrowth of bad bacteria. That is an oral candidiasis. And what you do, how do you treat that? What's that? Diflucan and nystatin. That's not how you treat it. That's how we used to treat it. I like you. The way you treat it is you open up the capsule and you put in a little bit of water.
Why don't they make a probiotic paste?
You don't need a probiotic paste. What you need to do is just open that up, put it in some water, swish and swallow. Why? You recolonize your mouth. Once you recolonize your mouth, it goes away. I can't tell you how many people I've done this with. And they come back to me and said, wow, my breath is better. And by the way, please don't use mouthwash. Don't use mouthwash. All right? Throw it out. Why is mouthwash so terrible? It kills all the normal flora. Why do you want to do that? You got bad breath? Don't kiss anybody. It's fine. Definitely don't kiss me. But if you have a problem with your breath, what you need to do is you need to brush your teeth, clean your tongue, and take a probiotic. Your breath is fine. It's going to work. Yes, sir?
The mouth and the gut bacteria are very different. Why does one probiotic work for top and bottom?
They're very different, but they're very similar. You have more, yes, the flora in the mouth is very different, but some of the lactobacillus will still flourish and work in your mouth. Lactobacillus rhamnosus is the most studied form of probiotic that's out there. There's 300, 400 studies just on that one strain. And it does work in the mouth. You're absolutely right. They have specific probiotics for the mouth. But then you're getting into a much bigger expense. But I'm telling you, the stuff that we have, I have patients that are on the probiotic that we use here at BioT. I've had them on for 25 years. So, this is a very interesting study. How many of you think H. pylori is H. pylori bad? Is Helicobacter pylori bad? Yes, it is. Don't shake your head. No, it's horrible. H. pylori is terrible. It's terrible. Who knows what H. pylori is? H. pylori is the bacteria that is thought to produce ulcers. First described in the early 80s. I graduated from medical school in 1982. And I remember reading about this, 1980-81, the New England Journal of Medicine. Crazy Australian taking H. pylori and gave himself an ulcer. Never forget that study. So is it a good thing or a bad thing? Come on, this is like, oh, is it a boy or a girl?
It's both. It's both.
It's both. You know, that's right. It is both. Overgrowth of anything is not good. Not enough of it is not good also. So let's talk about this. What H. pylori does is regulates stomach acid. But it regulates it through something called the CAG-A gene, which signals the stomach to make a certain amount of acid. If there's a dysfunction of this CAG-A gene within your system is where the problems begin. It's not the H. pylori. So there was a study that was done, and what they looked at was two things, ghrelin levels and leptin levels. When you wake up in the morning, your ghrelin levels are very high, and it tells your body you got to eat, you're hungry. And leptin, once you start eating, signals your body to say, whoa, you ate enough. These are hormones that are produced in the stomach. If you have H. pylori, after you eat, decreases your ghrelin, and what happens is that it tells it to shut down. But if you get rid of the H. pylori, you lose that signaling effect. So if you kill H. pylori by taking antibiotics, PPIs, and all the regimen that you go through, what happens? You shut down the signaling of ghrelin, meaning you will just continue to eat. And what happens when you continue to eat? You gain weight. So there was a study done on this. Poor veterans, they went to the VA, and they looked at 92 of them, and it showed that the group that gained the most weight is possibly due to the treatment of the H. pylori and shutting down the ghrelin. Because they didn't feel full, they just kept eating. It shut down leptin. So this is something, again, how do I treat H. pylori? Probiotics. Because H. pylori was thought to be a bad guy. It isn't a bad guy. You put the good guys back in, and the bad guys don't have a problem. They just get out of your system. So, this was a study on PPIs. People who take PPIs, proton pump inhibitors, Nexium, and all of those drugs, Prilosec, Pepcid, folks, you're shutting down the acid. You're shutting down the acid. If you shut down the acid, you can't absorb nutrients. If you don't absorb nutrients, what happens? You get a magnesium deficiency. I said this 20 years ago, and people looked at me and said, DeSilva, you're crazy. I have the PowerPoints. If you block acid, you can't absorb minerals. So, what's the deal, and how does this work? I'm going to use the front row as my intestine. Okay? So you guys over here are the first part of the intestine, the duodenum or duodenum. Pretty acidic, pretty cool area to hang out in. You guys over here are kind of the middle, kind of the in-between part of the small intestine. Remember, we've got 29 feet, or 26 to 29 feet of small intestine, right? And large intestine. You guys are kind of the in-between areas here. You're more of the distal small intestine. And you guys down there are the large intestine. Every one of these areas has a different temperature, pH, and environment where you like to live. You folks over here love the beach. I'm with you. That's where I want to live, right at the beach. Anybody want to go? Give me a call, we'll go. The Caribbean is calling me right now. You folks over here like the mountains. You like the altitude. You like the altitude because that's kind of where you grew up. You guys over here like the desert. It's a whole different environment. right? It's drier. Just a whole different thing. And you guys down there, it's a multitude of things that you may enjoy. But each one of you live in an area that you particularly like. You're acidic and you're more basic. So again, pH of 1, pH of 3. I give you an acid blocker. Give all of you guys an acid blocker. So what happens? I kill the acid. What's going to happen to all the bacteria over here? Where do you go? You don't go anywhere. You die off because you have no place to go. So I'm giving you a Nexium. You're taking the Nexium, the acid is being blocked, and you are right there. You have no place to go. Now remember, I've changed your pH. These guys over here really like this environment, right? So what are they going to do? They're all going to move over here. And what's going to happen to these guys? Everybody's going to start moving over. What happens to digestion? It doesn't happen because we don't have the environment to make to absorb the nutrients that are supposed to be right there. And what happens? This is where fermentation starts to happen versus digestion. So you start to ferment your food. You start to produce gas, belching, bloating, burping. Don't sit next to me on the plane. But we see this all the time. And as a result, what do? We keep giving it to you and keep giving it to you and keep giving it to you. And we wonder why we're destroying our systems. What's the treatment for somebody that has gas, belching, bloating, burping, reflux, IBS? It's a probiotic. You reestablish this area, and the food will continue to be digested. So you don't have the problems that you had before. That's how you treat H. pylori. That's how you treat gastritis, bloating, burping. That's how you treat an upset stomach. Obviously, you rule out. Make sure they don't have gallstones. Make sure they don't have something else going on. Do the workup. But as soon as they come back with a PPI from the doctor, get them off it, or, excuse me, let me change that. How do you treat that? Somebody comes to you, they've got reflux. They've got real reflux. They can't sleep. They've got real reflux. They've got real issues and problems. What do? They're on a PPI.
And they still have severe
And the PPI is controlling them. The PPI is controlling them. The Nexium is controlling them. You start them on a probiotic, and what do you do with the drug?
wean it off.
What my recommendation to all of you is this, and I've gotten this question for a number of doctors. What I do is I tell them to take the probiotic for a month. Stay on the drug, stay on the Nexium or whatever it is that you're using. When they come back to see you in 30 days, say to them, start taking the medication every other day. Continue on the probiotic. And what's going to happen is people are going to say, I don't need it anymore, so they'll skip 2 days. They'll skip 3 days. And that's how you wean them off. Okay, what did I do with my clicker here? Here it is. Okay, so pneumonia, people who take these, they're more predisposed to, if you take a PPI, you're more predisposed to pneumonia. Why? Because you're killing your immune system. You're killing your immune system. You can't kill off the bugs that are there. It all has to do with your immune system. And again, you can read this stuff here. I want to move on. Look at this. The gut has more than 30 neurotransmitters, namely serotonin, acetylcholine, and you can read all of this. 90% of your body's neurotransmitters, serotonin, is found in the gut. This study said 90%. So if you don't feel good, ask your patients, what percentage of your patients have digestive problems? A lot. And what are we treating them with?
PPIs.
With PPIs. Are we talking to them about what changes they need to make in the foods that they're eating? You have to. You have to. You can't just keep giving them stuff without giving them solutions, alternatives. Make it simple. Get off the soda. Get off the junk. Give up one thing and start drinking water. Get off the juices. You like orange juice? I had orange juice this morning. I had this much orange juice and this much water, just as a flavoring. That's all I'm asking you to do. That's all I'm asking you to do. And they will do it because they'll start to feel better. So serotonin, the gut microbiomes and products have a tremendous impact on the way people feel. A study from the UK, look at this again. Look at this. This again to me is frightening with autism and autistic children. Look at this is real data. Journal of Medical Microbiology studied the microbiomes of 58 autistic children, 12 non-autistic siblings, and 10 non-autistic unrelated children of similar age. The most striking finding was a presence and preponderance of Clostridium histolyticum in the autistic children compared to their non-autistic siblings or unrelated peers. We know that people that have C. diff have real neuropsychiatric problems. I have a patient who had C. diff who was just absolutely crazy. What did I treat her with? Probiotics. I mean, of course, you need to use the flagellum, metronidazole, whatever it is you need to use. Okay. But make sure you give them the probiotic. But this, to me, is frightening. Where do the babies get their flora? Where do the babies get their flora, the good bacteria? From mother, absolutely. How do the babies get the good bacteria? How? Before breast milk. How do children get their flora to start in their gut? Vaginal canal during delivery. The way babies get the flora is through the vaginal canal when they're delivering, when they're being born. What if mom doesn't have the right flora? What does the baby get? Bad flora. What's the problem? The complication comes into what if the baby is born via C-section? Where does the baby get the flora?
Breast milk, microwave milk. Just kidding.
From the nursery. In the hospital. We know how good the flora is in the hospital. Yes, we do. If there's a baby that is born via C-section, the baby needs a probiotic immediately. Immediately. They don't. My sister had triplets. That's because she's nasty and she's a lawyer. So she's not only nasty, but she's a lawyer, which makes her a nasty lawyer. So she's an attorney. She actually teaches law in the Navy. Her babies, not babies anymore, are 16 years old. The day they were born at Bethesda Naval, I drove from New Jersey to the hospital, and I said to my sister, they need to take this probiotic. And she had just delivered via C-section. So she said, whatever you want. One of the nurses came to her and said, I don't know about this. My sister looked at her and said, you just give her whatever my brother says, and I don't care. You don't want to mess with my sister. You just don't. The babies, to this day, take a probiotic. I call them babies. They're 16 years old, for goodness sakes. My boys have been on a probiotic all their lives. When they were in college, and you can ask them, both of my sons said, we never got sick. They got sick, it was for a day or two. All our friends would get sick. My daughter-in-law, who, as I told you, is pregnant, has been on a probiotic for I don't know how long. So when she gives birth, my grandbaby is going to get the right flora. And is also, I'm going to buy, again, while she's breastfeeding, flora for the baby. Jill's sister, who's going to deliver via C-section, is going to need to give the baby a probiotic immediately. So, for those of you that have children, for those of you that have children, your babies, your children need to be on a probiotic. It will decrease their incidence of colds and flus, missing days of school, infections, and believe me, they will not get sick.
Do they make those for kids?
They do make probiotics for children. Our probiotic that we have, you can give to children over the age of 10. 1 capsule a day, open it up. If they can't, I would prefer you open it up, sprinkle it on their cereal or whatever it is they take in the morning, and have them take it that way. All right? You need to do that. You absolutely need to do that.
For a baby, you just put it in a dropper?
For a baby, all you need to do is just dip it in. If it's a powder, just dip it in, wet it, dip it in. The baby will suck it right off. Okay, so let's go through some studies. Irritable bowel syndrome, you can read the data here. The authors conclude that the results suggest that probiotics can confer benefit in IBS and deserves further investigation. Folks, this is how I treat my IBS patients. Crohn's disease, ulcerative colitis, get rid of the sugar, take an omega-3, take a really good omega-3, and you're all set. What about male fertility? This is a study that was done on male fertility. Lactobacillus might not only be a potential probiotic for semen quality maintenance, but also for helping with getting rid of the bad flora in your system. Because the flora, again, will have to do with semen quality and motility. Eczema. Remember we talked about psoriasis, eczema, open up the probiotic, make a paste, put it on your skin, do it at night before you go to bed, also take it orally. The skin is the largest organ of elimination. When you start taking, and I spoke to a nurse this week from BioT who said, I had every single symptom that you talked about at your last presentation. So what I did was, I took 2 twice a day. It's too much. What happens when you overdose the system with a lot of good flora? What's going to happen to you? Your symptoms will get worse because you're having a die-off of the organisms. It's called a Jarisch-Herxheimer reaction. The Jarisch-Herxheimer reaction was first described in meningococcal disease, right? When we gave people penicillin, the meningococcus was killed, the meningococcus released a toxin, and it was from the 1920s or 30s, called a Jarisch-Herxheimer reaction. Same thing happens when you take too much of the probiotic at one time. So when you give your patients a probiotic, tell them you may have some diarrhea, you may have your skin break out more, you may feel like you are flu-like for a couple of days. It's the same thing when you give somebody iodine. It's the same feeling when you give somebody iodine. That's why I start slowly. Because what you're doing is you're going to detoxify, you're going to get rid of the bromide from the thyroid and the breast tissue. And by the way, iodine, really important for men, for their testicles and the entire system in the man. All right? So you're going to get this detoxification with the iodine, the detoxification with the probiotic. And what's going to happen is they're going to develop these flu-like symptoms. Let the patients know that. It will last about a week, increase the water, and it usually goes away. If it doesn't, cut the probiotic down to 1 a day. If it still is a problem, 1 every other day. And then you can build back up slowly. Don't start high and come down. Start low and go up. Recurrent urinary tract infections. How do we treat recurrent urinary tract infections? With antibiotics. Read the last line. The consumption of probiotics and antibiotics in children with recurrent UTIs is safe and more effective in reducing the incidence of febrile UTIs in comparison with prophylactic antibiotics alone. I talk to the urologists and tell them, just give them a good probiotic. And in women, in nursing homes, you got to use a probiotic and vitamin D in the nursing homes. What do they get? What's the first thing you look at when a person is in a nursing home and they start to get confused? What's the first thing you do? Is a urine analysis, is this urine CNS, right? That's the first thing you got to do, because if they've got any kind of a low-level subclinical infection, they're going to get confused. I put all of my ICU patients on probiotics. My residents know when they admit somebody to the hospital, they get 3 things. They get a multivitamin, they get a B complex, and they get a probiotic. And this is all on our hospital formulary. We've got CoQ10, we've got a whole bunch of stuff on our hospital formulary that I've put on. I've been there for 30 years. So, I've gotten that on our formulary, and it absolutely works. We use CoQ10 in intensive care. We use CoQ10 in ICU. By the way, just a little FYI for you, we're going to have samples for you of chocolate with xylitol. It has a glycemic index of 7 and has 60 milligrams of CoQ10 in the chocolate. Don't eat more than 2 pieces a day. Seriously, you will get an upset stomach, you will get a little bit of diarrhea, but 1 piece a day is a great alternative, all right? There's nothing wrong with something like chocolate, but the reason I mentioned the CoQ10 is because we use it in ICU. People that are in congestive heart failure, CoQ10, magnesium, D-ribose, carnitine. Unbelievable stuff. Irritable eye syndrome, subclinical inflammations. Again, you look at this stuff and say, what do probiotics have to do with this stuff? It's inflammation. It's omega-3s, and we'll talk about omega-3s in just a little bit. Childhood constipation, please, 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 don't give children PPIs for their reflux. The reason children have reflux is because they don't have the right flora. Don't treat constipation with drugs. Give the children a probiotic. It works. Don't treat the adults with laxatives. Give them a probiotic. Increase their water. It works. Again, the oral microflora. This question that came up. Periodontal health. Let's switch over to fish oils. Who needs to take a fish oil?
Everybody.
Who needs to take a probiotic?
Everybody.
Who needs to have their vitamin D levels checked?
Everybody.
Who needs to take iodine? Okay, you can all go home.
And calcium, everybody.
And well, yes, if you take vitamin K, the calcium is lower dose because K will move calcium into bone. How do I get people to take fish oils? What I tell people to do is tell them your cholesterol's high, your triglycerides are high, I want you to take an omega-3. You know what they say? Yeah, okay, but I get that fish, and they start to whine. They start to whine. I don't like people that whine. Just be quiet, shut up, and take it. You want to feel better? That's what I say to them. Do you want to feel better? Stop whining and start doing what I'm telling you to do. That only works with my patients. It doesn't work with anybody else in my family. Okay? So, how do you get people to take these supplements? The first thing I tell them is, if you take an omega-3, you will start to have better skin. You say that to a woman, she'll say to you, can I bathe in it? I usually say yes, but you'll have cats chasing you around the neighborhood. Okay? But it's true. Appeal to people's vanity if you have to. And it works. You want your skin to look better? Take an omega-3 and take a probiotic. You want to feel better? Do what I'm telling you and get rid of the sugar. And stop whining and just do it. So what is it good for? Skin, hair, and nails. Of course, your heart. Of course, for your lipids. Women that have GYN problems, for my perimenopausal woman. Reduces inflammation, gets rid of the hot flashes. How do I treat hot flashes? Besides with hormones. If they're very early, I give them omega-3s and vitamin E, a full complex of vitamin E, with 4 tocopherols and 4 tocotrienols. And it works. Why? Because it reduces inflammation. Of course, depression, OCD, ADD, etc. So let's look at some studies. EPA, with regard to lowering your risk of prostate cancer. Here's the data. Prostate tissue, omega-3 fatty acids, especially EPA, may be protective against prostate cancer progression in men with low-risk prostate cancer. Why not? Let's use it. Benefits of SSRIs. Look at this. The authors conclude that the preliminary findings demonstrate adolescents with SSRI-resistant depression exhibit robust DHA deficiencies and suggest adjuvant folic acid supplementation, fish oil supplementation, as well as tolerated, and increase the fatty acids in these people. And it works. This was a study that was done on memory and recall, brain function, Again, higher levels, overall better brain activity. Breast density, reducing breast density with omega-3s by reducing inflammation. Dry eyes. How do we treat patients with dry eyes? What do we give them? Restasis. Does it work? No. What happens when somebody has a dry eye? The outer coating of the eye, which is fat, as we get older, due to oxidation, starts to deteriorate. What if we give them higher doses of omega-3s? Maybe that'll work. It does. And here's the study. Executive brain function. You think better if you've got higher levels of omega-3s. Your brain is 60% fat. Why do we have omega-3s in prenatals today? Because we need it for babies' brains. Hemodialysis patients, people with arrhythmias, high-dose omega-3s, very beneficial. Insulin resistance. How do we treat insulin resistance? Get people off their butt, give them the right flora, give them the right nutrients, make them feel better, and they'll get out and exercise. If your vitamin D level is low, you're going to have pains, you're going to have discomfort, you're not going to feel like doing anything, your mood's going to be altered. Once you feel better, you'll get out and want to do more. What about endothelial dysfunction and systolic hypertension? What is systolic hypertension, by the way? How do we treat systolic hypertension? Antihypertensives, and again, I don't have a problem with using antihypertensives, but let's think about the mechanism for the physicians in here. What is the mechanism of systolic hypertension? Why does it happen? Who said that? Decrease elasticity of the arteries. Absolutely. The analogy what I use is this. You have a garden hose, right? The garden hose, as it gets older, becomes very stiff. If that garden hose was less stiff, you would have better elasticity. If you have better elasticity, you're going to have lower systolic pressure. So how do you treat that? Well, there's a couple of ways to do that. Number one, you can use omega-3s. You can use 3,000 to 5,000 milligrams of omega-3s. You can even go higher. And it works. What else can you do? The other thing you can do is you can change and have an effect on the vasculature inside the blood vessel, and this is important. And I don't have any slides on this, but I want you to visualize this. You've got a blood vessel, all right? You've got a blood vessel. The endothelium is a single-celled layer in the vasculature, right? All the way around. Single cell, endothelium. Right above it is an area called the endothelial glycocalyx. I am working with a gentleman right now in Amsterdam who I am convinced is going to win a Nobel Prize in medicine. He has found this layer called the endothelial glycocalyx. I have been tasked as to how to fix that, because with people with vascular problems, this layer above the endothelium, which is a gel-like slippery layer, by the way, it's the same layer that is on the outer surface of the eye that allows you to blink, that slides. It's the same thing that lines the gut, that layer. When that layer disappears, what happens is as blood flows, and how does that layer disappear? Due to inflammation. So when you eat a meal, if you eat sugar, that gel-like layer, slippery layer, goes from this size to this size. And over a period of time, if you're diabetic, will eventually disappear. Where the endothelium, that single-celled layer, becomes exposed. So when blood starts to flow, what happens to that endothelial layer, that single-celled layer? It lifts. When it lifts, as blood flows, various inflammatory cytokines will deposit in that area. And that is the beginning of unstable plaque. So, what destroys that layer? Sugar. Sugar. The two worst enemies to that layer.
Incense.
And what?
Incense.
NSAIDs, smoking. Smoking destroys that layer like this. We were able to measure this in the lab, and we actually have the technology to measure this in the lab, where there was a guy that worked with us that smoked. So what we did was we sent him out, we told him to smoke 3 cigarettes and come back. And we measured his layer. You know what? It was virtually gone. We then told him to go out and eat a hamburger and drink a Coke and come back, which he really liked to do. It was not as dramatic as when he smoked the 3 cigarettes, but it was pretty dramatic. We then got him to eat the same meal and smoke a cigarette, and it was completely gone. So, for those of you that smoke, you're out of your mind. For those of you that eat sugar and smoke, you're really nuts. All right, all joking aside, if you understood what is happening on a vascular level in your body, and Mark Hincher said this the other day, the world's best compensatory mechanism is the human body. It compensates for all the abuse that we give it. But when you really start to understand what happens when you destroy your systems, it is frightening how you will rethink what you do and how you do it. So, just again, be conscious of what you're doing, what you're eating, and how important this whole thing is. And omega-3s, by the way, omega-3s, vitamin D, probiotics, iodine, have a significant effect, a positive effect on this layer. And this is one of the things we're studying today. Also, brown seaweed. Brown seaweed has an incredible effect on this layer also. Okay. Pulmonary function, bless you. Remember I said to you before, asthma? Nobody should have asthma. Nobody should have asthma. What is asthma?
Inflammation.
Asthma is inflammation where? In the airways. Why do you have inflammation of your airways? Because you're being a ding-dong and you're eating ding-dongs. That's why you have asthma. Sorry I'm yelling. Nobody should have asthma. It's, for me, I treat it all the time. Omega-3s, diet probiotics, vitamin E, vitamin D. It goes away. I have a lawyer, I have a big shot judge that sees me in my practice. He only wants to see me when there's nobody there because he's very high profile. He said, Dr. DeSilva, I can't talk when I'm on the bench sometimes. I said, that's because you're eating junk. Look at you. You don't look like the picture of health. You look like you're going to drop dead. And I really got on him. I thought he was going to put me in jail, actually. But I really got on this guy. He changed his entire life. He looks great. He feels great. It's that simple. But you have to care. You really have to care. That's how you treat these people. Any of you that have children that use inhalers, don't tell me that your child will only eat hot dogs. That's your fault. That's your fault. If your child only eats hot dogs, it's your fault. Get them to change what they eat. That's your responsibility. You're the parent. Make it happen. Omega-3s and periodontal disease, again, reducing inflammation. The combination of omega-3s along with probiotics, I love it for the mouth. Rheumatoid arthritis, secondary benefit. This is one of the videos that we actually sent out to Costco. And I did a whole description in this little video on the secondary benefits versus secondary side effects. We don't have side effects with omega-3s. We only have secondary benefits. And what are the secondary benefits? Well, I'm taking it for my brain, or I'm taking it for my triglycerides. I was going to say testosterone. I'm taking it for my triglycerides. But you know what? My joints feel better. My joints feel better. My memory's better. I can focus a little bit better. My skin's better. That's how this works. Dialysis patients, I talked to you about this. Oxidative stress, again, reducing inflammation. All right, check this out. This is not in your slides. I just saw this also. I just put this in. So if you drink sodas and you have aspartame, you have sucralose, and you have saccharin, when you take, first of all, aspartame, when it's heated, changes to formaldehyde. So if you buy sodas that have been sitting outside at a gas station, it's already changing to formaldehyde. The aspartame is changing into formaldehyde. And you're drinking it. You're going to be well preserved. But it's going to displace hormones, and you're going to look like you've been preserved. Not in a good way. But what happens here, when they fed this to mice, what they found was that the flora changed, and the bacteria, the flora in the gut changed, and it started extracting fat instead of nutrients. So what happened? The mice got fat. Remember, if you don't eat sugar, it's a good thing, right? But we can use artificial sweeteners, and that'll be better for you. Wrong. You're killing yourself with artificial sweeteners. And I hate to say this. I really hate to say this, because don't misinterpret what I'm saying. It's better to eat the sugar than to take artificial sweeteners.
How about the new one?
Any of the xylitol, I really like xylitol. Xylitol is from a birch tree. It's an extract, a wonderful sweetener, very low glycemic index. Stevia, okay. The other one, agave, is very sweet, very high glycemic index. All right? Drink water. You want to hydrate? Drink water. You want to put a little orange juice and put a lot more water? Perfect. Do that. But here's the data on that. This is an Israeli study that was just published, and I don't remember where I saw this, but this is the data on that. So, I'm finishing up with this. Why are we different? The reason we're different, and I wanted to put that other slide in here, was that we have to balance everything. We have to balance our hormones, we have to balance our nutrients, we have to balance what we eat, we have to balance our exercise, and we have to balance our spirituality. What you balance with your spirituality is totally up to you. I don't want to talk about that. What I do want to talk about is the fact that there is a role for that. The reference for that, again, is Dr. Herbert Benson from Harvard University. His conference is called Spirituality and Healing. They do 3 days of presentations on prayer, meditation, and mind-body issues that will improve the quality of your health. Larry Dossey talks about it, Herbert Benson talks about it, Duke University studies it, it's all over the world. The data on it is excellent, and that's what we do here. We give you the hormones, we give you the nutrients, we give you the diet, and I don't like to use that word diet. You need to encourage your patients to move, and you also, and I really believe this, you also need to talk to your patients about their spiritual component, if they have one. You don't need to push your religion on them. That's not what I'm talking about. But that piece of relaxation, meditation, get those adrenals to come down a little bit at the end of the day. Go for a walk. That's what you need to discuss with them. Don't just tell them to exercise. So why are we different? The iodine that we have is made by the same company that makes the pharmaceutical grade Nutraceutical, which I am guilty of not paying attention to Ricky in the back for all of these years, and I'm glad I have, finally, and having a tremendous effect on my patients. It is this is not just iodine you just find on the shelf. It's an ideal balance of iodine and free elemental iodine that is highly absorbable and binds with tyrosine to produce these hormones. It also contains zinc, selenium, and potassium iodide. ADK, folks, there is no better supplement on the market for vitamin D than what we have. Combination of vitamin A, vitamin D, and vitamin K. You cannot find that anywhere except here at BioT. DIM, patented formula ensuring proper absorption due to the cofactors in the blend. There is no other product. The company that makes this especially for BioT, in the dosage, in the milligrams that we have it. Omega-3, this is an international organization. It's called the International Fish Oil Standard Program that tests for actives, contaminants, heavy metals, and also stability of radiation. This is a certification that is on the label. It's a certification that is on the label for our omega-3s. And last but not least, the probiotic. They're veggie caps, by the way. The iodine is also a veggie cap. Is a patented technology on the capsule. So the organisms that are in the capsule are protected from the stomach acid. Because remember, when we put that into the stomach and you've got all that acid over here, that's going to destroy that thing right open. And if it opens in the stomach with all that acid, it's going to kill all the organisms. It's not what happens. The capsule is protected, so it opens up in the intestine. And the bacteria, 2 forms of lactobacillus, 1 bifidum, goes and does what they're supposed to do into the particular areas of the intestine. It is a this particular group of organisms I have literally been using for 25 years in my practice. Once you start taking this, you will not stop because it is the best of the best. You know why? Because my name's on it. No, I'm serious. If I'm going to put something like that on it and then bring it over to Dr. Donovitz and to Mark Hincher here at BioT, it's going to be the best of the best. Because the problem is Mark Hincher will kick my butt otherwise. And I'm going to be in big trouble. And I sincerely mean that. It's the best of the best. So, with that, I will leave you with this. Do things for the right reasons. And from there, it all becomes very easy. I was trained by the Franciscans. I said the Franciscan peace prayer every day for a lot of years, and I still continue to do it. For me, it's about living the right way. Making yourself a channel of your peace. Where there's hatred, let me sow love. Where there's injury, pardon. Where there's doubt, faith. Where there's despair, hope. And where there's sadness, joy. We as physicians need to bring joy to what we do, and once we are happy, we will transmit that same energy to our patients. So let's do this the right way, and let's do this and make our patients healthy. Folks, I thank you very much. God bless you all. Have a great day.